Hey class, Gabriel here, and my how-to EMS related speech is on placing the patient on the appropriate amount of oxygen. Now in the pre-hospital setting, we come across a lot of shortness of breath patients, patients who have pulmonary disease, and also patients who are in respiratory failure and cannot maintain to open their own airway. Almost all EMS services carry an SaO2 probe that measures the amount of O2 levels in the patient's blood. Now, combining these levels, which is a percentage up to 100, with the patient's presentation, we can, a pre-hospital rescuer can determine the appropriate amount of oxygen to administer to a patient. First off, we're going to start with the nasal cannula. Nasal cannula is generally used when small amounts of oxygen are to be given to a patient without the rigid control of respiration. Most cannulas can provide low flows, usually anywhere from 2 to 6 liters per minute, and they deliver an oxygen concentration of 28 to 44% of oxygen, which isn't really much considering that the air we breathe in is 21% of oxygen. Nasal cannula is normally used in the elderly patients who can benefit from oxygen therapy but do not require aggressive oxygen therapy. Now we go to non-rebreathers. Non-rebreathers are administered to patients who need higher concentrations of oxygen. Generally anything, if their O2 sats are anywhere under 94 to 93%, we tend to go a little bit more aggressive and give them non-rebreathers. The non-rebreather covers the mouth and the nose, and it has a string that goes around, so it sits snugly on the face. The non-rebreather also has a reservoir bag, typically contains about a liter of oxygen. Before you place the non-rebreather on the patient, you want to make sure that the reservoir is inflated at least 2/3 full of oxygen. Approximately 1/3 of the air in the reservoir is depleted as the patient inhales. It's then replaced by the flow of oxygen coming in. If the bag is completely depleted when the patient breathes in, he has no air to breathe, so you need to increase the amount of O2, because with the non-rebreather you can administer anywhere from 10 to 15 liters per minute. That usually gives them anywhere from 60 to 80% of oxygen. The exhaled air goes through a one-way valve in the mask, which prevents the inhalation of room air and the re-inhalation of exhaled air. Higher concentrations of O2 causes vasoconstriction, so non-rebreathers should not be administered to patients who can negatively impact them. For example, strokes. You don't want to cause any vasoconstriction for patients who are going through a stroke, so you want to give them a nasal cannula. After the non-rebreathers, we have the BVMs, or the bag valve masks. Now, they provide positive pressure ventilation to a patient who is not breathing or their breathing is inadequate. This device is normally part of a resuscitation kit with trained professionals in the pre-hospital setting, and you also see them very often in the hospital setting as well. When you're using a bag valve mask, it's usually referred to as bagging the patient. Bagging the patient is normally required in medical emergencies when there's no pulse or the patients cannot breathe on their own. Most bags have a reservoir bag that fills up with oxygen just like a non-rebreather, but when you're giving the patient this oxygen, you're actually giving them 100% oxygen, and when you put the bag valve mask around the patient, there's going to be a nose cup, and you're going to do a CE clamp, which causes a tight seal, and you're also able to lift the jaw, to lift the tongue and not obstruct the airway. Now lastly, we have the ET tubes, or endotracheal tubes. This is a much more invasive procedure, and it takes highly trained individuals to complete this task. But these are for patients who are not breathing at all, and you need to secure the airway When you secure an airway, it does not allow the vomit from the stomach to come up and go into the lungs. The tubes usually range from a size 2.0 to a 9.0, and the best way to measure the size tube for your patient is to get the diameter of their pinky and measure it with the diameter of the tube, and that's a good indicator. And that is my speech on how to EMS relate it.